Using the disposable shovel and the paper towels, completely pick up all of the jellied substances and place it in a red bag. Seal the bag tightly using one of the twist ties provided. Put this sealed trash bag into a second trash bag. Do not seal the outer red trash bag at this point. Once the spill is completely cleaned up, place the disposable shovel into the outer red trash bag. Use paper towels and additional approved disinfectant to clean up surrounding areas that may have been affected by the spill. Place all soiled paper towels into the outer red trash bag. Once more, apply the approved disinfectant to the area following the directions for use on the product label. Remove disposable apron, face mask, and shoe covers and place into the outer red trash bag. Remove gloves as followed. With the right hand, pinch palm of the glove on the left hand and pull the left glove down and off the fingers. Form the left glove into a ball and hold it onto the fist of the right hand. Insert 2 fingers of the left ungloved hand under the inside rim of the right glove on the palm side. Push the glove inside out and down onto the fingers and over the balled left glove. Grasp the gloves, which are now together and inside out, with the left hand and remove from the right hand. Discard the gloves into the outer red trash bag. Seal the outer red trash bag tightly using one of the twist ties provided. Dispose of the red biohazard bags according to your local guidelines. Thoroughly wash your hands using the following approved hand washing procedure before returning to other duties. Reopen the affected area. Approved hand washing procedure. Wet hands and arms with warm running water. Apply enough soap to build a good lather. Scrub hands and arms vigorously for 10 to 15 seconds. Clean under the fingernails. Rinse hands and arms thoroughly under warm running water. Dry hands and arms with a single-use paper towel or warm air hand dryer. Use a paper towel to turn off the faucet and open the doors. Note, bloodborne pathogens kits can vary, but most contain disposable gloves, absorbent powder, antiseptic wipes, shoe covers, aprons, scrapers or scoops, disposable towels, protective eyewear, red biohazard bags, safety data sheets, and instructions. Several kits are available through Aramark preferred providers, including Granger and Hubert. Contact Supply Chain Management for a complete list of providers. Next slide. Post-exposure follow-up. Anyone who has been exposed to human blood will take the following steps. Cleanse the exposed skin area with soap and water for 15 minutes. Rinse mucous membranes or eyes with water for 15 minutes. Report the incident immediately to the supervisor. The supervisor will complete an incident report within 24 hours. The BBP exposure incident is referred to Aramark's designated occupational health service provider for evaluation. Post-exposure follow-up is determined by the medical providers in accordance with the United States Center for Disease Control and Prevention recommendations. Supervisor must call 1-800-645-RISK for exposure incident. Inspect and review. The supervisor inspects the work area as part of his or her regular walk-around management and initiates corrective actions when nonconformities are identified. The site manager, with the support of the standard administrator, performs a self-assessment on the site to verify implementation of the BBP standard. This self-assessment is performed annually using the self-evaluation checklist. Next slide. Training. Bloodborne Pathogens Awareness Training. All associates receive Bloodborne Pathogens Awareness Training during SAFE orientation. This training can be found in the Aramark SAFE Handbook and the new Associate SAFE Orientation video. The information provided in these materials include: associates are instructed not to touch or attempt to clean up blood unless you have been properly trained. Immediately report any blood spills to a manager. Associates who have been determined to have a reasonably anticipated occupational exposure to bloodborne pathogens will receive additional training. Bloodborne pathogens training. The objectives in the BBP trainings are to educate the associates about the potential risks involved when working around human blood and bodily fluids that could potentially expose them to disease and to describe the best practices, administrative controls, and PPE that decrease the risk of transmission. The training includes, but is not limited to, the following subjects: explanation of the bloodborne pathogens to which an associate could be exposed during their course of employment with Aramark, importance of disease preventative measures such as the hepatitis B vaccine, the best practices and administrative controls that are implemented to reduce the risk of exposure, how to properly don, doff, adjust, and wear appropriate PPE, the limitations of the PPE, the proper use and disposal of PPE, proper cleanup of blood or OPIM if required by job duty. After the training, the associates will demonstrate that they understand the BBP standard or they are retrained. Bloodborne pathogens training must be conducted annually. Associates are encouraged to contact their supervisor or the standard administrator if they have questions concerning exposure during any job tasks or to obtain a copy of the bloodborne pathogens standard. Next slide. Bloodborne pathogens training is documented in writing on the training agenda and roster and or maintained in Aramark's learning management system. Next slide. Record keeping. All records are maintained in accordance with Aramark record retention policy. OSHA 300 log and Sharps log are maintained for a minimum of 5 years. Copies of the completed self-assessment checklist for this process are maintained for the current year. Copies of the training rosters are maintained in accordance with Aramark Records Retention Policy. Next slide. Definitions. Bloodborne pathogens. As defined by Occupation Safety and Health Act, pathogenic microorganisms that are present in human blood and can cause disease in humans. Bloodborne pathogens include, but are not limited to, hepatitis B virus, hepatitis C virus, and human immunodeficiency virus, the causative agent in autoimmune deficiency syndrome, or AIDS. Engineering controls. Controls, for example, Sharps disposal containers, self-sheathing needles, safer medical devices such as Sharps with engineered Sharps injury protections, and needleless systems that isolate or remove the bloodborne pathogens hazard from the workplace. Exposure incident. A specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an associate's duties. Occupational exposure. Reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of an associate's duties. Other potentially infectious materials. The following human body fluids: semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva and dental procedures, any body fluid that is visibly contaminated with blood, and all bloody fluids in situations where it is difficult or impossible to differentiate between body fluids. Any unfixed tissue or organ other than intact skin from a human, living or dead, and HIV-containing cell or tissue cultures, organ cultures, and HIV or HBV containing culture medium or other solutions, and blood, organs, or other tissues from experimental animals infected with HIV or HBV. Personal protective equipment. Specialized clothing or equipment worn by an associate for protection against the hazard. General work clothes, for example uniforms, pants, shirts, or blouses, not intended to function as protection against the hazard, are not considered to be personal protective equipment. Universal precautions, an approach to infection control. According to the concept of universal precautions, All human blood and certain human bodily fluids are treated as if known to be infectious for HIV, HBV, and other bloodborne pathogens. Work practice controls. Controls that reduce the likelihood of exposure by altering the manner in which a task is performed. For example, prohibiting recapping of needles by a two-handed technique. Next slide. This is the conclusion of the Aramark Bloodborne Pathogens training. Thank you.